All right, we'll get started. Hello everyone, I'm Divya, and on behalf of Mantra Labs, I welcome all the attendees and our esteemed speakers to today's panel discussion on how digital is transforming the future of doctor-patient experiences. As you know, the pandemic has fueled an exponential growth in the digital health solutions, including telehealth and customer-facing health platforms, which are key to improving patient care abilities and reducing healthcare costs. It's no surprise that healthcare organizations are increasingly undertaking these initiatives. Therefore, today we'll be talking about upcoming trends, opportunities, and challenges in creating better digital experiences for the healthcare ecosystem in the MENA region. I would like to welcome our esteemed panelists. Our first panelist is Mr. Adam Dokrat, an IT professional with over 20 years in the IT sector with experience in UK, South Africa, Qatar, and the UAE. Currently working at Astra DM Healthcare as their head of IT retail GCC, he previously held the position of IT director at Life Pharmacy, Masafi Water, and the IT manager for AI Mana Fashion Group. He has implemented a large number of enterprise-level ERP and was the first in the world to implement MS Dynamics AX 2012 RT in Azure. Welcome, Adam.
Thank you very much, Divya, for the welcome.
Our next panelist is Mr. Jaleel Rahman. Mr. Jaleel Rahman is an IT leader with over 24 years of experience in diverse organizations and has expertise in IT service management, change management, project management, team management, solution delivery, and IT infrastructure design. Currently heading the IT division of Prime Healthcare Group, Mr. Jaleel has also served in senior positions at GlaxoSmithKline and Abu Dhabi National Insurance Company. He is a collaborative leader with a keen vision to understand business challenges and opportunities, cultivate effective communications, and influence business strategy and direction. Welcome, Mr. Rahman.
Thank you. Hi, everyone.
And our third panelist is Parag Sharma, who's the CEO at Mantra Labs. An IIT Kanpur alumnus, Parag has 16 years of experience building tech-driven solutions for global consumer enterprises. He began his entrepreneurial journey by building an online grocery app in 2009. Over the years, he has been instrumental in successfully building Visa, Selfash, Hitty, and FlowMagic. A passionate speaker, Parag has conducted various webinars and podcasts on AI transformation with industry experts across several domains. Welcome, Parag.
Thank you, Divya.
I'd also like to introduce Niven Simon, who will be moderating today's panel discussion. Niven is our head of Mantra Research, market research team, and is passionate about all the topics related to AI transformation and digital products and solutions. Hi, Niven. Welcome to the panel discussion.
Thank you, Divya.
Before we dive into the panel discussion, I'd like to give a little bit brief about Mantra. Mantra Labs is an experience engineering firm that builds and designs customer-facing products for evolving enterprises. Starting its journey with an online grocery app, Mantra has worked closely with the startup ecosystem, building products and solutions using the latest technologies. Today, Mantra is a team of more than 250 plus passionate engineers who have delivered 125 plus projects across the globe in various industries. With the forte in product engineering, Mantra creates engaging experiences for digital consumer touchpoints. Covering a broad spectrum of services, Mantra handles end-to-end product lifecycle management, mixed reality and multi-device app development, product innovation strategy, creative visual storytelling, and gamification for customer journeys. With a strong background in digital health spread across domains, Mantra has built digital platforms, complex web portals, mobility solutions for some of the leading hospital chains, diagnostic centers, pathology labs, health insurers, medical imaging companies, etc. For Manipal Hospitals, Mantra built a 360-degree mobile platform helping them manage more than 2 million patients annually. Through the mobile solution, users can avail many services easily, such as booking appointments for consults and vaccines, buying healthcare packages, tracking their health reports, access their medical records, to name a few. For Alchem Pharmaceuticals' Connect to Clinic initiative, Mantra built a robust, scalable, and secure doctor-focused platform which has already onboarded 40K plus doctors. It's a platform where doctors are able to manage their clinics, connect with their patients through teleconsultations, manage marketing campaigns, etc. It's a community-driven platform where doctors can even engage with their peers and discuss topics of their interest. Continuously experimenting with latest technology, Mantra has built a strong capability in engineering AI-powered solutions for its clients, such as building an image processing-based cancer detection system for Pathomic, which is an AI-enabled computational analysis platform. Mantra has also built a research tool which is powered by artificial intelligence for the purpose of extracting information about genes and their interconnectivity for AbbVie, which is a US-based biopharmaceutical major. Amongst Mantra's in-house product portfolio, Hiti, which is a conversational AI chatbot with an exhaustive list of features such as appointment bookings, video consultations, customer intelligence, sentiment analysis, multilingual capabilities, to name a few. Another product that Mantra also has is FlowMagic, which is a workflow management platform built using machine learning algorithms with interactive UI that requires no coding effort and replicates entire business processes. FlowMagic has a host of apps on a platform which each solve problems, for example, a medical invoice processing using OCR, car damage assessment app for claims, etc. YSR Mental Therapy Bot is also one of the products that were incubated at Mantra, which is widely being used across the globe, especially in this pandemic, and it's one of the highest rated emotional wellness bots by Google and App Store. Apart from working with these healthcare giants, Mantra has also worked with Suraksha Diagnostics, Change Healthcare, for some of the leading insurers in countries such as Aditya Birla Health Insurance, Care Health Insurance, SBI General Insurance. Mantra has built digital experiences for its users around insurance policies, renewals, claims, health checkups, etc. Apart from working with the healthcare and insurance behemoths, Mantra has also built scalable solutions for who's and who of the startup world such as Ola, Myntra, Quikr, etc. In speaking of India, Mantra is also working closely with the government on National Digital Health Mission, building a framework that integrates the healthcare providers with their patients. Without any delay now, let's get to the main part of our panel discussion. Let's dive into you, and I hand my mic over to Nivin. And before we begin the panel discussion, I'd just like to tell our attendees if they would like to ask a question, they can type in. You will see a question, a small icon with Q&A where you can type in your questions, and we will take it up at the end of the panel discussion. We have kept a little bit of time for any Q&As that you might like to take up. If you'd like to raise your hand, there is a icon for raising hand as well. We'll also be running a few polls, so feel free to actively participate in the polls as well. All right, Nevin, over to you.
All right, thank you, Divya, for those introductions. Welcome everyone to this panel discussion on the future of doctor-patient experiences and how digital is enabling this transformation in healthcare. So the idea for today's webinar is to have a constructive dialogue on the current and future state of healthcare for MENA. I will pose questions to our panel and hopefully we can hear their thoughts on these topics. So for everyone attending, we will also be running a few polls alongside these discussions, so feel free to participate as we go along. So let's recap the last 18 months to understand how we got here and why this subject is pertinent today. Since the pandemic began, digital and healthcare have never been more closely associated together. As telemedicine went mainstream in the last year, many people accessed healthcare through this channel. A majority of them were first-time users, and some experts say that this shift is permanent, that it is becoming the care of choice. And not just from the consumer side, doctors are also embracing and prioritizing the shift to prevention and well-being. Today, there is more adoption of EHRs, health management apps, and tools, and the patient health apps than at any point before in history. So there's a growing trend of health tracking, and there's an even more growing sense among care providers to deliver guidance to consumers over digital channels on their health journey. With that being said, Adam, once again, thank you for joining us. I will turn to you to start this discussion. From a healthcare provider's perspective, looking to retain these health consumers, what steps can be taken to make patients feel more engaged and involved in their digital health process?
Thanks, Niven, for asking this question. I think it's a great question. I think it's really important that we, use digital healthcare and we use digital tools to get the patients engaged, to get them part of the journey, and not just that, is also to find out, their opinions, their feedbacks, and how we can help them again in the future. I think, using the digital tools, using things like an end-to-end mobile application and getting stuff from appointment booking right the way to consultation, to their lab results, and directly into their medicine and their pharmacies. It's really important, and that's how we engage them, is by providing them with all the services under a single roof and under a single banner. Giving them extra features like medicine reminders, reconsultation reminders, and really cool stuff like AI system checkers, coverage and benefits for their insurance, and personalizations for them. Making them really feel like it's their digital experience as opposed to just some sort of generic application. And then in terms of the feedback and the opinions of them, I think it's important to capture, their NPS, giving them every opportunity to feedback to you, whether it's positive or negative, doing things like sending SMSs after the transaction to their SMS, to their WhatsApp, making phone calls, utilizing especially digital tools like automated call centers to digitally phone the customers, engage their opinion, and by doing all of that, collating all that data and then using that data to enhance the customer's journey. I think that's a lot of the ways we can use those tools to help engage with the customer directly.
Great, yes, I agree. And it's not just about creating doctor scheduling apps anymore. It's about building the complete broad horizon of what healthcare can do for the patient, right? So Jaleel, I'll pose the same question to you. What are your thoughts on how digital tools can better create engaged patients?
All right. Thank you for bringing that in, because in the world when everyone talks about customer experience, for us it's patient experience, right? And I think Adam touched upon many of it in terms of that engagement with the patient. And I think what we sometimes forget is that the preference of the patient as well, because we need to be on multiple channels. It's not maybe just on mobile app, and I think Adam also did allude to that. Whether it's digitalized contact center, because each one will have their preferred channels, and we need to make sure that we are in that same digital maturity on all channels of customers' preference. I think that's quite important as well, and the transparency with the patients in terms of their visits, their prescriptions, their reports, and the timeliness of informing that is quite important, and as well as the feedbacks, right? I think the next stage where we are also now seeing is how can we do those kind of reminders for their missed appointments based on their medical condition. So there's a lot of data of a patient that we already have. Can I look at that data and actually have some biomarkers which I can use to remind them what's the next thing that we need to do? So it's just actually moving from falling sick and visiting a hospital to the wellness part of it. I think that's what is now coming out with the data that we have, that the providers like us can look at the wellness of the patient. It actually helps the patient to maintain the condition while they're away at home, and not only engage with them while they're visiting the clinics or only when it's time for us to engage with them, but can we do that continuous engagement so that we take care of them and address their wellness part of it and ensure their condition improves and not worsens before the next visit. So I think that's what we're seeing emerging. That's quite easily said, but the part of it because of the data quality and many other things. To achieve that is not a great task. I mean, not an easy task. So yes, but that's where I think everybody is now moving into in terms of patient engagement.
Yes, and I like what you said about how the approach is being turned in on itself from reactive to proactive, and that jump is not an easy one to make, especially like you said, quality data is at the spearheading the need for that transformation. So Parag, from your point of view, from someone who is into crafting these digital health solutions, what is your take on what you see digital tools occupying that space and filling the gaps that doctors and patients can now have better, more engaged experiences through these solutions?
Right, Niven. So, of course, my thoughts will definitely echo with what Adam and Jalil have already said in this forum. In addition to that, I would like to put across a few points which probably can enhance the patient's experience further by making use of wearable devices, being able to capture the data where the patient is, and then being able to make and take those proactive measures and steps rather than waiting for a patient's condition to come to a point that he needs an immediate care. Right? So if you can make those interventions before it becomes so emergent, and with the help of technology today, you have all the tools and means available to be able to help the patient when you can actually make a significant difference in their healthcare system. So I believe technology is what we should look at. Wearable devices are there. We have a lot of means. We have cloud, which can easily help us collect all of this data and analyze this data in real time. So today's analytical systems are so strong and capable that you really do not need to do a post facto analysis of the data which is coming in. You can actually process and analyze and even take actionable insights that will come in as the data is coming in, rather than doing it later, maybe a day later or post facto. So I think those are the kind of things that will make a big difference to the existing applications, which, I mean, when we talk about various applications for appointment bookings, payments and all, of course, those are table stakes. They're definitely given that those systems and applications need to be there. But in addition to that, we can always leverage a lot of modern technology to enhance the experience much to a next level.
Yes, I agree. And, that ties well into another topic that relates to this, which is another shift that we are seeing, which is the shift to home, or bringing healthcare to the patient's door, right? So it's estimated that the home health market in MENA is expected to touch somewhere between 36 to 38 billion by 2026, which is the next 5 years. And this is accelerating on the backs of rising chronic conditions and the recent surge in patients also being digital first these days. So Jalil, let's start with you. And in your opinion, how can providers transform that doctor-patient relationship from being visit-centric to home-based?
Yeah, thanks, Simon. I think it's, as you rightly said, it's an extension of what we just discussed. When we talk about proactive and well-being, especially for chronic, we know that what are the steps that the patient needs to follow at home to maintain their condition, or for the condition not to get worse. And there are variables and quite a lot of data that can be that we can receive from the patient. There are devices now the patients are having on their own, but that data is not coming back. Now, while my experience in the pharma industry some time back, we had, even now it's available. There are certain softwares and devices which collect these data, but then they bring it back to the physician, only for the physician to use at the next visit. So the whole thought process is now different. Can't we get that data real time and get back to the patient on real time when we need to intervene than waiting for the patient to come back? So that's what's really going to happen in the home care. The normal home care services are there, but when you talk about home care for chronic conditions, I think the shift is really there, where you can actually collect that real-time data, analyze the data, and I think it's going to get to a place where it's more like IT, SOC centers, where you will have care managers looking at these data, only exceptions of the data, not all the data, because it's going to be quite a lot of data, right? If you have a diabetic patient who is going to measure 2 times or 3 times the blood sugar, and that's going to come in. So you look at the variations in data, you look and give them a call back, say, okay, it has gone up. What's the reason? You do that, proactive action, so that you don't wait for them to come back. And so that's where really the home care, I think, is going to. We have seen home care scenarios where people have looked at ICUs, remote ICUs, and even a same has been taken to bedridden. But I think we are now going to talk about people who are not bedridden, who have that regular normal life, but they need these, because of chronic conditions, they need these other attentions. And there are already devices, as I said, which people are monitoring on their own. I think it's more now, how do we connect that devices back to our system, and also that the same data system can be used, or same data can be used even while the patient visits, but it can be also used before the patient visits. So that's a nice part about it. And the other part is, if you already have other data which you are all like other clinical conditions, which because the patient has been visiting, you can actually correlate to that as well, which your EMR and other systems throw out. So you can correlate to that and as well get back to the patient. So I think you will have a good 360 view of the patient in terms of not only what he or she's doing when they're coming and visiting you or doing the labs and radiology at your facility, but also what they're doing when they're at home. So that gives a better picture for us to intervene and give a better care, and end of the day, and better output for the care as well.
Right, absolutely. And we've known for a while that prescriptions, diagnostic reports, and previous hospitalization records, these can create a rich compilation of patient data, and can possibly help healthcare providers like yourself design personalized treatment plans for each individual. So Parag, to what extent perhaps can this also apply to a home-centric care approach?
Same points as Jalil have already mentioned. I would definitely echo with a lot of them. That when you are at the home, you should be able to capture a lot of information from the patient's well-being and be able to take actions before it gets too late. In addition to that, your ability to understand how the patient's health is in real time will help you to come up with a treatment plan which is more and more personalized, rather than a very generic plan which might work for a lot of my patients, but possibly not for every patient out there. So if you have this specific data coming in from a specific patients, then you can actually use AI technologies to even help physicians and doctors to come up with the plans, because sometimes you just overlook some of those exceptional aberrations which can be easily spotted by a technology, rather than always depending on humans' ingenuity and intelligence to be able to spot out those differences. And in case if there are similarities that have been found from the past and similar treatments which ended up benefiting patients, probably the doctors and the physicians can be advised with that kind of a treatment plan with this system. So I believe a lot of opportunities will open up once you start getting this data and then be able to take action on this data.
Yeah. Just to add one more thing, Simon, on that is, we've already seen small, different use case scenarios of these being put into use, especially during pandemic. So I've read about a hospital who are giving them a device and asking the patients to go home, and actually they were remotely monitoring the SpO2 at the oxygen saturation and other breathing difficulties by keeping kind of a something below their bed. So I'm not sure what the technology was, but then there are a few things already emerging, and there are a few trials happening in different specific cases. So we've seen that happen. So all I'm saying is I think it's going to get more mature, the devices and the reliability of these devices and the data, but because that's quite important, because we do have a lot of wearables right now, but not all wearables are FDA approved and are clinically the data is like of clinical quality that actions can be taken. Of course, you can take certain directions on it, but then the doctors might not be willing to treat based on that data. They'll still need to use retest some of those parameters when they visit the clinic or the hospital. I think that's where I think we want to see some more maturity, but there have been some models which have been already tried during the pandemic.
Adam, do you see home health being part of that bigger picture, at least in countries like UAE?
Yeah, I think home health and I think service delivery to patients is a huge topic, especially here. We're here in Dubai. We're used to additional services like Carrefour and now shopping where we get our stuff directly to our door, and healthcare is going the same way in terms of that on-demand service. And and like Gillian and Parag said, using that data to then serve the customers better. Taking it from a customer perspective. Or from my side, more from a delivery perspective in terms of medicines, and that just getting those medicines directly to the customers, saving them those visits to the pharmacies, allowing all that information that we get being passed on to the relevant center, and then that whether it's a lab technician, or whether it's a pharmacist, or whether it's a home healthcare worker, getting those people out directly to see the patients, especially those ones with chronic conditions. Like Jalil said, the guys who will find it difficult to actually go into medical centers. And then again, using digital technology. I mean, it doesn't have to be that when you're going from an inpatient to a home visit, it doesn't mean that home visit always has to be physical. Telemedicine, digital apps are now just coming up more and more, and you can have you can have that physical visit once a day or once a week, and then you can then supplement that with those digital visits as well through dedicated apps and systems, and that to allow that patient to get that better experience and to get the care they want to in their home without sort of stepping out and putting themselves at further risk.
Absolutely, and the use of AI is so broad. Like that there's a lot of work being done to improve prediction of patient room turnover and even that turnaround time. So it's just a broad range of things, which is very
definitely
exciting.
I think we were at GITEX this year, and we were having a look at the different wearables, and now they're going away from wearables and putting on-wall devices, which are 3D cameras to detect falls and that. So you're not reliant on the patient then to have a physical device for a fall. These AI cameras and these infrared sensors are there to detect any issues that are happening, whether it's body temperature, whether it's heart rate, or whether it's fall detection. I think the technology is coming up, and it's going to be a really exciting time in the next couple of years, in terms of what technology can help everyone else.
So when it comes to the healthcare delivery of tomorrow, it has to be on demand. That's where healthcare eventually has to move towards. There's a lot of disruption happening in this space. Egypt and UAE, they have the most startup health activity in MENA, followed by countries like Palestine, Lebanon, Jordan, and Saudi. But the best experiences are on demand today. Like your Netflix, Amazon, and Uber. If it's not on demand, it doesn't exist in the customer's mind. So I read recently something interesting on the usage of health and fitness apps, which is they say it's growing 87% faster than the app industry as a whole. So it is definitely the right time to think about developing on-demand healthcare services. But if you're moving just beyond what is now considered basic, Parag, I'll start with you this time. What is the desired blueprint for an on-demand health app for tomorrow?
So number one is that the approach should definitely be omni-channel. You can't really build the home care or go-to-home app or a treatment considering only one of the channels in mind or few channels in the mind, when we are realizing that a very diverse set of our patients and our users are coming from various channels. And sometimes it becomes just easy in case if you have a care app which can be accessed from, let's say, WhatsApp kind of a bot. Right? So you don't really need to download and install an app from your healthcare provider if it can just be consumed just like you consume or you write messages to your friends and family on WhatsApp platform. So that's definitely number one. The approach has to have an omni-channel approach so that you cover up all possible channels. And then you look at start making use of a lot of data which can be made, which can be put to good use, to be able to understand how your patients are doing in terms of their health. And then, of course, having an analytical systems to be able to keep track of the data which is coming in, so that your treatments and your interventions can happen in real time without losing any time. So depending on some of these areas of technology, if we are designing our entire system in such a way that we're able to make interventions or bring interventions in time without losing an opportunity to provide a quick treatment to a patient, and of course being able to provide the patients with all possible channels. So that would be my two takes on the overall blueprint of such a system.
Jalil, let me pose another variation of this question to you, because I think Parag's kind of given us a lot of insights on this. So, there's health tracking behavior is on the rise, but only a few HCPs are actually giving health feedback to consumers. And this is an area where, a trusted doctor-patient relationship is still paramount. So can on-demand health apps of tomorrow change this perception?
I think it can. I think definitely, and it will, because the adoption by patients and the doctors, actually, I would say, if you've seen what has happened in the pandemic and telehealth, and it's been our own experience as well, where we had a lot of, because the technology was there always, and there was a lot of resistance before, and when people really experienced it, and the whole perception changed after it for both the doctors and the patients, and there's a lot of preference for, like Adam said, after a discharge from the hospital, a few visits can be, they don't really need to drive back into the hospital or a clinic for follow-ups, all right? So that pattern is now kind of establishing, where you have a mix of a physical visit and a telehealth. Chronic medications, refills can be tele, only when they are due for a next visit and examination, they need to come in. So there's a lot of things that's happening, and people do realize that, especially for cities like Dubai, where traffic could be a concern as well. You save a lot of time by not really driving into a clinic, and these are the so they start realizing that they know it's working. Once the doctor and patient bond is built, that can be continued by a virtual one as well. So the same applies here. So the importance is data and how you address the patient. I think we did talk about that earlier. As long as it's customized messages, as long as it's customized to that patient, and it's of value to him or her, and it's not generic information, yes, this is going to, that's the way. So I think what I'll add on to what Parag said is, yes, omni-channel, but there's also the customization part of it. You need to look at data, you need to address the patient, we need to talk about that patient's condition and what's benefit for him or her, and not really the generic things. So what used to happen before was, whether it be emails or SMSs, would be a lot of generic, like you pull in a certain condition of patients and you send them specific generic information. But here now you're going to address each patient. So if one patient logs into WhatsApp, or whether it be the mobile app, they get specific to their condition, and they get messages for and the advices for their condition, and that's what is going to make a difference. So if we're able to do that, yes, that stickiness and that adoption would be there. Just one thing I wanted to mention, what challenges with omni-channel is also the regulations, because we might not be able to give the same experience on all omni-channels, right? Our own experience has been, I can't really send a report on WhatsApp, for instance, because WhatsApp does not allow medical reports to be sent. They can request for it, so I can give almost the same experience as my mobile app, but end of the day, he or she will not get it on the WhatsApp. They'll have to request for it, and it'll go to the registered email address or some other channel. Whereas on a mobile app, they can have it immediately. So there are regulations, and there are tools which might stop us from giving the same experience. But I think I still agree that we need to be, as I said in the beginning, we need to be in all channels. But a full experience may be more easier on a mobile app compared to few other channels. And the same thing is the experience for the patient. This is where I think one of the initial hurdles that we'll have to overcome is when you talk about normal, the grocery shopping and many other things that you do using these different channels is much more easier, because it's not as regulated as an healthcare industry, right? Whereas you will have a lot more steps in terms of when you try to take an appointment, or when you try to download your report, because we need to confirm it is the patient who is actually trying to do this. And because of regulations, maybe we cannot even share that patient's condition with somebody else, right? So, so that becomes a little more difficult in terms of a patient experience, because they're going to be comparing this experience with something else they do, not an healthcare experience. They're going to comparing it with online shopping, or some of the other experience, and that's where I think that realization or that adoption would have a bit of a challenge in terms of realizing, okay, this is going to be a little more, maybe 2 or 3 steps more compared to just booking an online ticket or buying something online.
Yeah, and this challenge can be greatly exacerbated by diverse groups of people, especially take a city like Dubai. It's very multicultural, a lot of expats and migrant populations. So language is also going to be a key factor into figuring out how to deliver these experiences. So Adam, I'll pose the same question to you. How do you see on-demand health apps navigating these challenges?
So I think what Jaleel and Parag said is great. You got to look at omnichannel, you got to look at data, you got to look at the regulations and everything. But I think a couple of things that people miss. I know I touched upon it earlier, but the first part is that you've got to look at not necessarily omnichannel, but the different use cases for different patients. I think especially in a multicultural society like the UAE, you've got to look at patient skill sets as well. You've got to look at the ability of some users to interact with a mobile app, some users to interact with WhatsApp, for example, some users to interact with a phone call. I think there's lots of different technologies which can be suited for different audiences. Which leads on to my second thing. I think one of the biggest things that we don't do as both IT and business professionals is we don't listen to our customers. We don't really engage with our customers directly and say, what do you want? How can we design our app to make it serve you better? Because I think what we tend to do is put ourselves in the position of the customer and then try and design it for them, as opposed to the other way around, where we go directly to the customer and say, what do you want? How can, what services would benefit you? And, how would you like to access them? And then reverse building the app that way. And I think by doing it that way, you're generally going to touch upon a lot of the pain points that customers are facing. And then augment that into your revenue strategy, because obviously everything has to drive, is driven by revenue, is driven by patient visits. So you back work, the requirements, and then push the revenue strategy, and the combination of both of those together ultimately will allow that next app for tomorrow. When you look at something like Netflix, for example. Netflix started down the route of posting videos to customers, and very quickly after customer engagement realized that actually we don't want to post the videos to the customers. They want that on-demand service, and they were quick and they were agile enough to readapt their business service, whereas companies like Blockbuster just sort of carried on with that postal service. And we see where Netflix is today, and we see where Blockbuster is today.
Absolutely. And those kind of ecosystems are what's changing healthcare as well. Because, especially if you take the case of India, they're adding new frameworks that support health IDs, PHRs, OPD insurance. So this is sort of going to create the next wave of macro level demand beyond just your local catchment zones. And that is perhaps another opportunity that providers will need to take advantage of to reach more patients. So, speaking of engaged patients and an engaged future, augmented reality and virtual reality, these are big buzzwords these days, and they are also making inroads into healthcare. Just outside of healthcare alone, a lot of the consumer internet companies are investing heavily into these spaces, like your Facebooks, Google, etc. Snapchat has made integrations into the new Google Pixel 6 phones. Facebook has introduced new AR filters I just read about today called Polar. There are a lot of VR games being released on next-gen consoles. So technology like this exists. Maybe over time, it'll become more affordable to the masses as it permeates our day-to-day lives. So Adam, I'll turn to you first. How do you see these technologies making the health experience more immersive?
So I think it's a great question. I think it's definitely something which is going in that direction. Facebook recently changed its name to Meta, not because it wants to go down that VR route. I think they see the benefit of VR, they see the benefit of AR, and they see the benefit of a fully engaged experience. And I think we're definitely going to be going down that route. I think services and options are going to come to us. I think the wearables at the moment, I don't think so much the price point at the moment. I think it's more the wearables and the technology behind the wearables and the ease of use for people. I think the current, big unit format isn't suitable for for long-term usage. I mean, I have a full VR setup at home, and we use it for 30 minutes, 45 minutes, and you can't carry on with it just because of the strain on the eyes. But I think once we get into that sort of glass level technology, I think it's going to be a lot more interactive, and I think it's just going to bring up a lot more information. I mean, you can imagine that just taking from a doctor and a patient experience, you can imagine that while a doctor is examining a patient, and that reader on the side there feeding him all the relevant information in terms of lab reports and all the information, so he can see the information, he can visualize everything. So if he's put for example, a heart rate sensor on a patient, and he can see the heart rate in his eye as he's operating or as he's consulting with a patient, I think all of that data and giving all of that data in the front field of view to the doctor is definitely going to allow them to make better decisions and interact with the patients more. And this sort of technology is available. I think Google Glass already does it for doctor interaction and for warehousing and things like that. So I think the technology is there. I think the adoption will be sort of the biggest piece.
And companies like Magic Leap and Microsoft's HoloLens, they're making these immersive, highly visual technologies that combine virtual and real environments to create that extended reality, or so to speak. And so, Jaleel, I'll turn to you. Can AR, VR, does healthcare have an appetite for that in the near future? And more importantly, can these technologies perhaps be used on the front line?
Okay, on the second part of it, can it be used? I think, like Adam said, yes, it can, but I think it's going to take some time. What I've seen is the education side of healthcare is adopting it much faster because it's much easier. I've seen tools even in GTEx and other technology events. There are tools which can train doctors on procedures, so without really having a patient, doctors can repeat those procedures multiple times, and it actually monitors the accuracy of the procedure being done. And so there are quite a lot of things on the education and training side. But I think in terms of a patient engagement, yes, it can be done, but I think there's a lot more value-added things that will come in first compared to the total value it gives. But this is something that might take a little longer. That's my perception. I could be wrong there.
So Parag, I'll turn to you as a resident technology expert.
I have similar thoughts. Yes, definitely technology is evolving, and it will definitely be very, very soon that we will have adoption of these technologies coming into the mainstream. And I am expecting that education sector would definitely be one of the first, especially the medical education, wherein you really do not need a patient with a kind of a situation or problem to be really for your expert doctors to explain it to the junior doctors as to what kind of treatment under what condition has to be provided. So in case if you can create an AR, VR tools around it to mimic that kind of a problem, it's much easier to help the junior doctors understand the problem and come up with a solution. So definitely medical education is going to be one of the first few areas where they would like to adopt these technologies. Frontline, yes, it might take some time. I'm not very sure if this technology is already being used during the procedures, but I believe that during the procedures also this technology will definitely come and aid the doctors to be able to do their job better.
So thank you guys. Thank you so much for taking the time to answer these questions. Now we'll open the floor for a quick Q&A session. For the next few minutes. If anyone has questions, please either ask in the window provided on the left, or you can raise your hand and you can ask. Go ahead and ask. Yeah, I don't see any questions from our audience. I think we can try to wrap this up. So I'll hand it back over to you, Divya. Once again, I would just like to thank our panelists today, Jalil Rahman, Adam Rokat, Parag Sharma. Thank you for your time. Thank you for your wonderful insight. I'm sure we all took a lot of learnings today. So thank you again. I'll hand it back over to you, Divya.
Thank you, Navin. It was a wonderful discussion with a lot of insights. And no worries if anyone has any questions, not right now, but later on, you can definitely write to us at, I'll just share my screen. Here's the email ID wherein you can write to us, and we'll definitely take it up and reply to you over mail. So you can get in touch with us on hello@mantalabsglobal.com, or you could visit our website as well and check out if there's anything else you would like to ask. To sum it up, I would first like to thank everyone, all the esteemed panelists for taking out time from your busy schedules and sharing such great insights on the upcoming technologies, about the current trends that are going on in the MENA region. I'm sure our audience has loved it, because I loved the entire discussion. And so here we come to an end. I would also like to thank all the attendees for joining the session. And like I said, you can please feel free to share your feedback about the session with us. And we'll also share the recording of this webinar to you shortly. Thank you once again. Have a great weekend. Stay safe, stay healthy. Thank you so much.
Thank you, everyone.
Thank you, everyone.
Thank you. Goodbye.
Bye.
Bye.